The pilot drill is utilized to begin the implant osteotomy. Its pointy taper design allows very precise positioning of the initial osteotomy. The step drills, you will notice, all have measurements, 2 measurements indicated by each drill. The larger measurement indicates the larger section of the drill. The smaller measurement corresponds to the diameter of the smaller end of the drill. There are 2 measurements because the drills are of a stepped design. The initial part is the smaller measurement, and the deeper segment is the larger measurement. So this drill, which comes from the slot that says 2.0 over 1.5, indicates that the apical portion of the drill is 1.5 millimeter and the coronal portion of the drill is 2 millimeters. The step design allows each initial portion of the drill to fall into the previous osteotomy. So the 1.5 millimeter measurement on the beginning of this drill will correspond to the initial pilot osteotomy made by that pointy pilot drill. It will then widen the osteotomy to 2 millimeters. When we move on to the next drill, the apical portion of the drill is 2 millimeter. The more coronal portion is 2.4 millimeter. This 2 millimeter segment corresponds to the larger section of the previous drill, to the 2 millimeter section of the previous drill. Therefore, when that osteotomy is begun, this segment of the drill will fall into the osteotomy and be guided by it, and then the coronal section will be enlarged. If we look at our step drills, there are 2 lines. There is a short line and there is a long line. The long line, or the long step drills, may be used to prepare osteotomies for the complete line of lengths of implants, 6, 8, 10, 11.5, 13, and 16 millimeters. The short line of stepped twist drills may be used for the 6, 8, 10, and 11.5 millimeter implants. Because they are short, there are no lines, or they're not long enough to be utilized for the 13 and 16 millimeter lengths. The short line is generally used when there's minimal interarch space to prepare the osteotomies, such as in the posterior mandible or posterior maxilla, and usually you're going to be placing implants on the shorter end of the spectrum or line of implants. The long step twist drills are what are utilized most of the time, and they're especially important when you're placing implants adjacent to teeth, where the teeth may interfere, or the tooth structure may interfere with the ability to bring the contra angle close to the level of bone. Therefore, a longer drill becomes important. When we examine the step drills and we look at the measurement lines, we can see that there are measurement lines for the 6 millimeter, 8, 10, and an 11.5 millimeter line. But if we were to actually measure the distance from the line to the tip of the drill, we would note that the length is always a 0.5 millimeter longer. So if we were preparing an osteotomy for a 6 millimeter implant to this line, the measurement is actually 6.5 millimeters. On the box itself, there is a measuring guide. And so if we look under the drivers or the insertion keys for the placement of the implant, we can see that there is a schematic of the implant indicating the 6, 8, 10, 11.5, and 13 millimeter line that will correspond to the lines on the drill. So if you get confused and you're not sure of the measurement of the line, you can hold it up to the schematic on the box, and the schematic has the millimeter measurement for the implant length. But remember, the actual drill length is 0.5 millimeter longer. When following the drilling protocols, we will first use the pilot drill to create a precise initial osteotomy. And then if we were to place a narrow platform 3.25 millimeter diameter implant, we would then follow with the 2 over 1.5 millimeter step drill, drilling to the appropriate line, and then follow the blue line to use the final drill, which again has the blue color on its shank. If we were to place a 3.75 millimeter implant, again, we would first utilize the pointy pilot drill for a precise initial beginning of the osteotomy, and then we would follow through by first following the green line, which first passes the 2.0 over 1.5 millimeter step drill, then go to the 2.4 over 2 millimeter step drill, following the green path, and then coming to the green final shaping drill. These final drills also then can be utilized or are utilized as countersinks. So, for the 3.25 millimeter drill, we would go through the sequence: pilot drill, 2.0 over 1.5 step drill, final size shaping drill, and then if the bone is dense or there is dense cortical plate, I would then go to the next size, the 3.75 millimeter final drill, and it is utilized as a countersink, but only drilling to the first line, to the first 6 millimeter line. So drilling up to that first line gives us countersinking. And that's the same process or protocol for each diameter. If the 5 millimeter implant requires countersinking, we have a separate kit that is not part of the Premier kit, and within that separate kit we have a countersink that can be utilized for that process.